Thanks for the patience. Okay, Dr. Chaminda Weerasiriwardena, Senior Counselor and Psychotherapist in Kandy Hospital. Dr. Chaminda Weerasiriwardena obtained his Bachelor of Medicine and Bachelor of Surgery and Postgraduate Diploma in Counseling from University of Colombo, Diploma in Psychology and Higher Certificate of Guidance and Counseling from Institute of Psychological Studies. He is a member of National Institute of Professional Counselors, life member of Sri Lanka Medical Association, and member of National Institute of Professional Counselors. He worked as a counselor and psychotherapist and resource person to island-wide principal training programs conducted by NIE, Central Province, Department of Probation and Social Services, Ministry of Social Service, teachers teaching skill training for Central Province, Ministry of Education, awareness programs in national schools, develop students' learning skills and stress management and resource person to Sri Lanka Rupawahini corporations as well. Dr. Weerasiriwardena has conducted various training programs for Ministry of Health, Ministry of Justice, Ministry of Education in Central Province and Western Province, and Sri Lanka Army, Sri Lanka Police, Department and private sector industries such as Mars Group, Sublogic Private Limited, Luck FM Radio, World Vision, as well as several schools in Sri Lanka. So may I cordially invite Dr. Weerasiriwardena to present your presentation. Over to you, Doctor.
Thank you very much. Give me a minute to open my slideshow. Right. Good evening, everybody. First of all, I would like to thank this OPA, that is your the Organization of Professional Association of Sri Lanka, for inviting me to share some ideas with this group of professionals about the advantages and the advantages of distance learning. And it is my pleasure to address you all in this evening. So the thing is, with this COVID pandemic situation across the country, as teachers and the parents, we would not let our children's education to be disrupted. We don't like that. So because of that, we had to get adapted to this distance learning system or this process. The thing is, for this, the requirement of these electronic devices is arose because of this pandemic situation. So, but the thing is, as you know, according to our cultural settings, as the first, these electronic devices was mainly used by our children for the entertainment purposes, not for the learning purposes. We all know that. Our students are playing games, watching television, watching movies, right? That is our normal process. Right. So there are only few students or few adults use these devices for the educational purpose. Because of this situation, an adult, as we try to keep these electronic devices away from the children, as we try to limit or restrict the access. We have fear. We have a fear about these devices. Most of the time, children are used to play those devices for the entertainment purposes, not for the educational purpose. But unfortunately or fortunately, we don't know that, right? But unfortunately or fortunately, with this COVID situation, prevailing in this country, what happened? The distance learning system introduced. Distance learning system introduced. We were forced to give these devices to our children. We were forced to give, but our parents don't like. We are not. We have an intense fear. They have intense fear when we give the devices. They don't know what they are going to do, what kind of things will happen. They have intense fear about this using devices in our children. Right. So then, as I mentioned above, as the devices were kept away from the children, with the restriction and the limit, they were not trained. Actually, our students not trained to use these devices in a useful and effective way of their education. This is the main crisis. We are not trained to our children to do these devices in an effective way. We don't have the proper learning. Only devices we are using for the entertainment, most of our children. Therefore, they mainly focus on using these devices for the entertainment. Then another problem began. That is, our parents have very busy lifetime. Then children were alone with these devices. And the children were alone with these devices. Then what happened? Because of that malhabit of these children, so the children's malhabit, inside the children associated with this technology. So they used to devices for the negatively affective purposes. So our students, they are used to devices for the negatively affective purposes, such as gaming, addiction behaviors. There are so many maladaptive behaviors they are used to use these devices. So my focus, in this presentation, my focus is describe what are the health hazard or health effect of these devices and the digital learning or ongoing learning. As described by the Dr. Tara Dimel, she told that the global situation of digital learning, she nicely explained the real situation, the actual situation in our country as well as our international.
Excuse me, doctor.
Yeah.
Sorry to disturb you. Are you moving the slides or not yet?
No. Now I am trying to move in now. Okay.
Right. Okay. Thank you. I thought there is a technical issue. Thank you.
No. Right. Now, we are in the children are in now technical era. We have to come that situation. So when the devices, right? The thing is, when the devices that we have to use for the learning and other purposes, what happened is there are so many theories and so many things has developed how the screen time is affecting our health. So my main focus is the screen time and the devices, how it affect our health, mentally, emotionally, physically, right? How the screen time and the devices affecting our health. I think Dr. Tara Dimel mentioned most of the part of my lecture, but she described most of the global situation. I am specifically focused for how screen time and the use of screen, how it affects our brain and the learning and the mental health. Okay. Now, this the one of the famous researchers, his name is Strakes, is a pediatrician as well as is a professor of pediatrics. parent and the researcher who influence the finding are help identify the optimal media exposure for the children. He's one of the great researcher has found how the screen time affect our brain and the learning and our mental health. Right? First, I think we go his findings. He will describe nicely what is happening when we use the devices in an appropriate way. He will describe those things, right? He found when the prolonged exposure to the rapid image changing during the critical period of brain development, right? This is for especially children. This is not the adult. His main focus is exposed to the rapid change during the critical period of brain development. What happened? Preconditioned mind to expect high level of stimulation. So he found when they expect high level of stimulation, what happened? Inattention in later in their life. So that when you are using the screen for entertainment purpose, but online learning, we are using for screen for the not the entertainment, for the academic purpose. It's a different aspect. But I will explain what are the health effects on screen, especially blue light, how it affects our brain and the memory system and the sleep. We will discuss in later. But this is the key point. When we are overusing the screen for the entertainment purpose, what happens? The children may develop inattention in their later life. Right. He demonstrated by doing a very fascinating research. I will show it. Right? He chose a group of mice, and 10 days of life. It's a very small one, 10 days of life mice. Then the mice was overstimulated. They are overstimulated by using the sound, the screen, right? There are so many stimulations he provided and overstimulated. 6 hours per day and for about 42 days. 42 days, he overstimulated this mice brain. Then he studied changes in the behavior of the normal mice and the hyperstimulated mice. This is his research find, right? What he has found is very fascinating result, right? Then we all know the mice always have this what we call the secure. They are highly sensitive for their threat. So they normally mice used to get like this borders, not come to this middle area. You know, these mice always go like that, right? This is their normal behavior. Because they don't like to take risk. The brain is developed not to take risk. That is an intrinsic property of our brain. So if you have a risk, we identify whether there's when there's a risk, suddenly we withdraw or suddenly we escape. So mice also like that. So you can see when the mice was overstimulated, what happened? This is the behaviors of the normal mice. You can see here, this is the normal behavior. They don't come to this risk area. But when the brain is overstimulated, what happens? They come to the risk area. So he concluded that when the brain is overstimulated with screen, there may be a health condition. That is, you are vulnerable for hyperactivity and also vulnerable for risk-taking later in their life. This is his first finding, right? this is not because of the digital learning for the academic purpose. This is when you are using for the entertainment purposes, right? I will explain those things, right? Then what is the second finding is very, right? I will show you the second finding. Then novel object recognition. You know, we all have the learners have what we call the curiosity. We all have a curiosity. The curiosity is the force to, is the key point, key psychological point to motivate for the learning. Once Einstein said, I don't have a special talent, I am fascinately curious. So the curiosity is the key point in learning. So studies, when we are overusing this screen for the entertainment purpose, what happen with the curiosity and the learning? So what he had done is he put these objects into the mice cage, right? These are not familiar to mice. They come and they hit this, and they behave around these objects, right? When the objects are familiar, they don't go. They don't go as like we, right? They don't go. So the next step is he put out one object. Say about this one, he put out. And before that, he divided this mice group into two groups, and one is overstimulated and other kept at the natural environment. Then he put out this one and add new object to the both cage. What will be the result? The result was fascinating. You can see the normal mice, their behavior is always they used to go to the novel objects. They behave with the novel objects. But you can see the overstimulated group, but they not used to go to this novel object. They always with the same as the family object. So he speculated when the children are overusing these devices or screen, the curiosity will be affected. So we have to carefully guide them, our children, when we are using this screen. Now we are using our screen for the entertainment purposes as well as the academic and the learning purposes. But learning, when we're using the learning purpose, we have another health effect. But when we are using our screen for the entertainment purposes, we have another health effect, right? You can see also he pointed out like this, right? He has found that at the age of 3, most of the time what happened, when the children are stimulated by the devices, not the cognitive programs, they were always stimulated by the television and other devices. What happened is, at the age of 7, more likely to have attention problems, right? Then if the children get cognitive stimulation, like cognitive games and some normal day-to-day play school activities, and interact with the environment, interact with the parents and the adult, what happened? Less likely to have attention problem in their later life. So that's why we are very careful. When we are very careful by using these devices and the object, whether we are using for the entertainment or whether we are using for the academic purpose. But it also he pointed out that when the screens are using for the educational purpose, no harm, no harm. But for the entertainment purposes, the harmful effect is 60%. When the children are using this violent, the devices are used for the violent entertainment, like the war films and the murder films and the other violent films, what will happen? There's a high tendency for inattention and the risk of problems at school, more than 110. So it's a huge impact. But what is a positive thing is when we use the educational purpose, these devices and the internet, no direct effect for this behavior and the emotion, right? But another fact I want to point out, that is what? That is the dark side of the blue light. But when we are using these devices, the main point is this dark or blue light. No, blue light has a health hazard, right? Right. So actually it directly affects our sleep cycle. I will explain how it affects our sleep cycle. But this is the main problem when we are using devices for the academic purpose. Because of this blue light. Every devices normally emit the blue light. So sleep, a basic need of our life, a complex phenomenon, is not fully understood. Actually, we don't know the correct mechanism of the sleep. It's not inactive stage. You are physically inactive, but your brain is very active. Sleep means you are physically active, but your brain is fully active. Right. So how much you sleep? So there are so many sleep researchers around the world. They have found every age has a sleep time. Right. This is a graph. You can Google those things. It's a very common thing. Right. Then how sleep is regulated? This is very important point. There is a hormone called melatonin. We need melatonin for our sleep health. We should have a good concentration of melatonin. Melatonin is regulated by the light. Is regulated by light. I think this diagram describes it. We don't want to go the finer details. Right. When the light is getting darker, what happens is the melatonin concentration is gradually rising. So when the melatonin is rising, we feel sleepy, and normally we go to the sleep with the melatonin dose. So melatonin also help to maintain our proper sleep, as well as it help to our memory consolidation. The melatonin is the well-known hormone to help the learning. It affects our memory consolidation, right? So this is what is the visible blue light. Is a spectrum of our visible light spectrum. Is a blue light is a part of it, right? Then where does blue light come from? Blue light normally come from the sunlight, computers, TV, and the other lights, cell phone, and the tabs, right? There are so many instruments they have identified. There are all these devices emit blue light. Okay. Now blue light interfere with the sleep. This is the phenomenon. This is the health problem. When we are overusing these devices, this blue light go through our eyes, right? And it go to the hypothalamus and shut down the melatonin secretion. Shut down the melatonin secretion. Then what happens? Pineal gland can't produce melatonin because of this over blue light. Not only other part of light, specifically they have found that blue light. Then what is the result? Delay in production of melatonin reduce the amount of melatonin. That melatonin, the reduced amount of melatonin cause lot of problems in our brain as well as in the learning. What are those? For learning and memory. You know, learning, the acquisition of the knowledge and the consolidation and the recall, right? Now see, learning, consolidate and the retrieval. But sleep, the process of consolidation normally happens during the sleep. It's called, there are so many stages in sleep, especially in REM sleep, within REM sleep. So consolidation means you store the learning material, learning content, you store the brain. This process is called consolidation. So then poor sleep aggravate or poor sleep affect lot of areas in our life situation. One is your memory consolidation. Most of the students, they are learning till around 10, then they stop the learning, then they try to watch films after that. I have so many students I have met. You know, there are some students, they used to sleep around 2 a.m., 3 a.m. after watching. Most of the time they tell me I am watching because of I have a lot of hard learning in the morning and the evening and the early night, but I need some rest. So because of this rest, I play with these devices. So I saw with this, but what will happen? Then it create the low melatonin. Then what happened? It affect the memory consolidation. So they can't store the things they have learned. So this is a direct effect, right? Another thing is it increase for the risk of communicable diseases. We all know there's a huge problem. This communicable disease all around the world is a huge problem. This communicable disease. So the lack of sleep directly affect our communicable diseases. In the same way, poor sleep also lead to obesity. So when we use this over this screen over, when we are using over and over this, especially the blue light, what will happen? The low melatonin affect our sleep, and children are getting more and more obese. So it may be another health hazard in our part of our health. So, all right. Then reduce sleepiness, increase, right. This is also the smartphone light ruin the sleep schedules and lead to this kind of health problem. You can see the lot of health problems it can happen. So the sleep play very important role in our health, right? Then effect of immunity. I think this pandemic area, we need a good immunity, especially with this COVID, what we call this new trait, right? This is what we call the COVID viruses, right? So when when you have lack of sleep, means it directly affects your immune system. directly affect your immune system. So what will happen? There is a vulnerability for getting infection, especially COVID this Delta trait, right? There are so many cases that we have. Normally, it's come through our media. Reinfected patient, right? Actually, we don't know what their sleeping cycle. We don't know what their health habit, how they use their screens, right? Okay, now the mental health issues, also the problem. You see the concentration problem may be 68, and the impulse control problem may be 75, and the risk of anxiety is a part of what we call the anxiety disorders, and the aggressive issues, and the risk of depression. These are the mental health issues with poor sleep. Then can we avoid, or can you avoid using computer, smartphone, and other blue light emitting devices? It is difficult. We can't keep away those things. Especially this pandemic, we are forced to use those things. So we have to develop the guidelines. We have to develop the real practice of using these devices. We have to give the guidelines to the parents as well as the teachers and the student. Right. So I will take another few minutes to describe what are the practical things that we can use to guide our students and the teachers to the parents, how these devices are using effectively without affecting your health. So decrease day and night time electronic use much as possible. So the number one thing is decrease the day and night time electronic use as much as possible. That is number one. The hour or two before the bed, no electronic devices, do relaxing activity. Ask your students, ask your children's, do your screen works most of the daytime, right? But Dr. Taradimel mentioned nicely, most of our teachers, they started their online classes around 11 p.m. 11 p.m. Sometimes it's go to 2 a.m. right? 2 a.m. It is very inappropriate, very destructive behaviors with this pandemic online learning. So an hour or two before the bed, you avoid or keep away these devices and go relax activity or read the printed materials and go and sleep. Then another guideline is make your bedroom screen freeze on. No TV devices from your bedroom, and encourage your kids to do the same. It's another guideline. Right. Then nighttime mode or computer screen. But because of this online learning session, we are forced to do this learning with this computers. What is the best practical thing is we can use the blue light filters, especially nighttime mode or computer screen. Now inbuilt, some computers and some computers as well as the other devices, they introduce the blue light filters. So use the blue light filters. Then it filter the blue light. Then the harmful effect, a certain degree, will reduce. Then blue light filters on your phones. If you're using the cell phone, keep switch on the blue light filters. I mentioned here, these are the blue light filters. All devices now, they have introduced these blue light filters, right? Then night mode reading. When you are reading, use the night mode reading. Then it also reduces the blue light effect. Use the night mode for the reading. And the devices, when you are using the devices in the night, most of the time you use this night mode reading. And also blue light blocking apps. There are so many software development companies, they have introduced so many apps for the blue light blocking. Right? Download and use those things. It also helps to reduce and cut down the blue light. So it also reduces the harmfulness. Right. Then another thing is we can use the blue blocking glasses. We can use the blue light filtering. There are so many glasses they have introduced. Sometimes these are very useful for the student, for the children. When they use these glasses, what happens? It filters the blue light. But the thing is, normally the branded one is over 8,000, maybe around 8,000 branded one. So the thing is the money, right? Okay. Now, right, these are the actually basic things I want to introduce when we are using those devices in this pandemic area. One is the children are most of the time they are used to use these devices for the entertainment purpose. But when the children are use these devices for the entertainment, we should careful. We should have careful. Otherwise, there's a huge amount of health hazard. But when you are using the devices for this, what we call the online learning, but the effect is low, but we have to careful about the blue light. The blue light, right? So if you use the blue light, so the effective and the adversity is less. So, however, we have to use those things, and we have to go with these devices. We don't know when this pandemic over, but we have to use these things, and we have to careful, and we have to educate. We have to education. In I think I suggest as a government we should develop the guidelines for the schools and the teachers. We force to government to develop the proper guidelines how you use these devices in appropriate way. And we have to educate the teachers, the parents, what is the bad effect of this screen and how the screen use in effective way without avoiding the harmful effect to the brain. Okay, thank you very much for listening my lecture.
Thank you very much for Dr. Chaminda Weerasiriwardena.